Hey, good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Welcome back to Open Mics with Dr. Stites. You can find me here every Wednesday talking about all things COVID, as well as other topics. But right now, COVID seems to be the topic of the day. And for the near future, we're going to focus on how COVID is wreaking the havoc on our communities and our health systems. We've been getting a lot of questions and concerns as children are back in school. In studio with me today is pediatrician Dr. Brad Nelson, who is treating children for prolonged COVID symptoms or long haul. He is a trained pediatric rheumatologist, and we're going to be talking more with him shortly about what he's seeing and what's going on out there. Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, is dropping off his kids. He'll be able to pop in just a moment and share the morning COVID patient numbers in just a moment. Let's talk first and see if there are any reporter questions on the line. Okay, I'm not hearing any. So Dr. Nelson, welcome here. Now, just to be honest, I've known Brad Nelson since he was a really little kid because I know his mom and dad. His mom's a pediatrician, adolescent medicine specialist. His dad's a pulmonary critical care doctor. We trained together here at KU. He taught me everything I know about pulmonary, which I don't know if that's a good thing or a bad thing. We'll just have to think about that sometime. But they're both great docs. And Brad is their son. He's a great pediatrician here at KU. As I said, he's a trained rheumatologist, and he's doing the long haul clinic for kids. So that means, I guess, there are long-haul patients, Brad, with kids.
Yes, we are. We're seeing patients that have very similar symptoms to what the adults have seen on the adult side in terms of long haul. So,
how often is that?
It's probably not as frequently as on the adult side, although, and that's what the numbers would say so far, although I think that may potentially change with the Delta variant, especially as we're seeing kids get more severe symptoms with COVID than we had previously.
So is that the same sort of brain fog, headaches, shortness of breath, dizziness, same thing we see in adults?
So that's a lot of what I've seen so far. So a lot of especially mood symptoms, so depression, anxiety, new onset. In addition to that, some brain fog, generally just fatigue, not feeling back to themselves.
So, Dr. Nelson, is this the only long-haul clinic for kids in Kansas City? Is there one at Children's or at Overland Park?
To my knowledge, we don't have anybody else seeing long COVID patients.
Yeah.
And so, yes, I guess we are the only one in the game right now.
So how many kids are you following with long-haul symptoms?
I currently have about 10 to 15 that I'm following.
And so what do you do for these kids?
A lot of it's the same as on the adult side, so it's really targeted to their symptoms. And so for kids who have fatigue and are having a hard time kind of getting back and moving again, a lot of it's focused on physical therapy and return to normal activities. For kids who are having more depression, anxiety symptoms, a lot of times it's getting them in touch with a psychologist or therapist, someone that they're able to work with, and again, getting routines back in place for patients.
So a couple of other questions just to broaden this out a little bit. So the COVID-19 crisis in children, I'm sure you have to be seeing their health effects and their psychological effects. What do you think about it? Talk to us a little bit about that.
Yeah, I think in addition to seeing the health effects that we've noticed with COVID, we're also seeing, obviously, the psychological effects. It's very formative time in life for children. They are being socialized. They are learning all the things that they will need as an adult to be happy and healthy. And it's taken a toll to not be able to sort of get back to some of the normal routines. And so in addition to the health effects they're seeing, they're also seeing the psychological effects of just not being able to be kids.
So, that's a tough question, right? Because, are schools safe in your mind right now? Do you think that schools are pretty safe?
I think schools in general are pretty safe. Again, the American Academy of Pediatrics has recommended that we get kids back in school in person. That said, I think that we always have the opportunity to make them safer, and that includes masking policies that I think are generally safe and effective. Again, once the vaccines are approved for a certain age group, it is totally appropriate and a good idea to go ahead and get those. So again, anyone older than 12 at this point, the strong recommendation is that they get the vaccine, and that helps protect other kids and adults and really everyone in the community.
Any ideas or any thoughts about when we'll start seeing data come out about how the vaccines perform in children?
That's a great question. I think hopefully I would anticipate probably later on this year, perhaps into early next year, we'll see some of that data start to come out. As of right now, I think we've seen that they've been safe in kids that are 12 and older for which they've been approved at this point. And we're expecting to see younger kids be able to start getting them soon as well. So in the coming months.
Okay. Tell me this. Do you think that the vaccine will be safe as long as from this question about myocarditis and pericarditis in young children?
Yeah, so regarding the sort of myopericarditis, that is something that has been well looked at this point. Actually, the American College of Rheumatology, along with a bunch of other societies, came out and after reviewing the data and what we'd seen in kids and said, yes, this does appear to be something that is related to the vaccine. However, we have seen that the myocarditis, pericarditis that we've seen in kids has been less severe than what we've seen when they actually get COVID. In addition, most of the children are not being hospitalized, nor are they needing any specific treatment for this. It tends to be a very self-limited process, and so the recommendation from all the relevant medical societies has been that it is safe and overall it's worth the risk of getting the vaccine.
Okay, and so. Did you see the article or the thing from the CDC that came out, I think it was yesterday or the day before, describing the teacher in California who took her mask off and about half the kids in her classes got infected with COVID-19. Did you see that? I
did actually see that.
Yeah.
Yes.
Talk to us a little bit about what you think happened in that situation. What does that tell us as far as the danger to kids from COVID-19 and being in school?
So, I mean, I think it tells us that we have effective ways to help prevent it, and then when we see that we're not following sort of some of the recommended protocols in terms of helping to keep everyone protected, that everyone is then put at risk, and that kids are especially susceptible to picking up these new viruses and then to actually passing it on to other individuals as well.
Yeah, I think that's really important. And for our listening audience, what happened is the teacher wore the mask most of the time, took her mask off in order to read the kids a story, read the kids the story, put her mask back on, and then during that interval, it was the dynamics were the dynamics. The kids in the front row had a really high chance of getting it. Half the kids in the class got it, the class of 24, so 12 or 13 didn't have it, or got COVID-19 within 48 hours. They started showing symptoms, which is the Delta variant because it comes on pretty quickly. And so they tested all the kids in the class. So the front row was most susceptible than the next row, and then after that it pretty much died off a little bit. But it just, again, the infection dynamics are exactly what they say there. And I think the kids even had masks on.
I think that's true as well. And that, again, what we've seen a lot with masking is that really it's a helpful, especially in protecting other people from your potential to spread the disease if you're infected. And so it's really about sort of that selflessness of wearing a mask so that other people don't have to suffer.
Yeah, so Delta variant is highly contagious, but it doesn't leap tall buildings in a single bound. It can't go passing through walls. It can't survive, ultraviolet radiation or whatever, or kryptonite for that matter. But what it really can't survive is somebody wearing a mask. If you wear a mask, you won't spread it because it's not a superhero or a supervillain. It is a villain, however.
Yes.
So just to say, it is an interesting note that people wearing masks weren't as protected, but what we don't know is how many more kids would have been infected had the kids not been wearing masks. Because, I think there's this whole thing about the density of the breath cloud. So if it comes to you and you're really close to the teacher or whoever doesn't have a mask on, then it may well penetrate your mask. But if you're further behind, you may not have that viral load may not penetrate and make you infected. Whereas if you didn't have a mask on, I think it's fair to ask, I wonder if even a lot more kids in that school could have been infected.
I think from a biologic perspective, from a medical perspective, it makes sense that having a mask on does give you some protection in addition to protecting other people from you and any germs that you might have. So I definitely agree. I think that we may have seen more kids be infected had they not been wearing masks at all.
So now you don't have children yet, right?
I do not.
But you're only like 12 or 14 years old, if I remember, since I've known you only for quite a long time. I think you can't be more than 12 or 14, so you've been vaccinated, though.
I have indeed been vaccinated.
Okay,
I made it
awesome.
just under the wire.
You just did.
Just
Thank
got
you.
it. I
You
just
must
got
have
it.
gotten the Pfizer
13.
vaccine. That's
Yes,
right.
right.
That's
Yeah.
it. Okay. Well, good. At least you're right at puberty or something like that.
Yes.
I know you have a beard, so it's got to be around there someplace. All right. I think there are a lot of things going on in the world of COVID right now, and it's been a difficult time. I think one of the most challenging things is when governments step in and start telling schools they can't have kids be masked. You can't have a requirement for vaccination. Those things are very difficult because it makes this crisis that much harder. And I think the hard part is that when you let healthcare folks do healthcare, it works pretty well. We try to let the political leaders do politics. But man, at the end of the day, we got to work together to try and keep each other safe. Jess, let's see what questions our viewers have today. I bet they have a few.
They do. Hold on, I'm getting to them really quick. A couple of people are asking, I'll ask you this. A couple of people are asking about how safe it is just to be outside on the patio, eating at restaurants, not knowing who's vaccinated and who's not vaccinated. Is that safe? Not safe?
I still think that's pretty darn safe. Everything I'm seeing, and there's really some interesting stuff that came out from the Lollapalooza concert. 385,000 people gathered in Chicago. Now, in fairness, they had to prove they were vaccinated, and they had to wear a mask unless they were eating. Which, if you play it right, when you go out to eat for dinner, your group, you're all vaccinated, you wear your mask except to eat, and you're outside, that's the Lollapalooza concert. And the rate of infection from the Lollapalooza, there was no super spreader event. There wasn't this great big boom in the number of infections. And so I think what that teaches us is that even large numbers of people can come together and be safe if they follow the rules of infection prevention and control. Now, they could eat when they took their mask, or they could take their mask off when they ate, but they had to put it back on. So I think the lesson is what we keep relearning. Outside is better than inside. Keeping your mask on even outside is a good idea unless you're going to go eat and drink, and then you're probably going to you'll be safe. And try to stay in places where everybody is vaccinated. It is clearly safer. When I last talked to the Kansas City Public Health Department, they weren't seeing a lot of events coming out of the Royal Stadium. Again, you're outside, right? And I'm telling you, not a lot of people had their mask on when I went to Royal Stadium. So I think that really you can be safe when you're outside. You're even safer if you keep your mask on except when you're eating, and especially if you're amongst those who are vaccinated, like the Lollapalooza concert.
Becky wants to know, could the virus have been spread through the eyes? Maybe talking about the children that were sitting there and they were masked. Do we know anything more about if
that's a
this
great
is
question.
transmitted through the eyes?
That's a great question. The answer has been, I think, and I'll just look at my audience. We welcome Dr. Hockfack into the studio. What do you think, guys, about the spread in the example of the California school teacher who spread it within the classroom? Even though the kids were masked, whether or not that may have been, especially in the front row or two, could that have been spread through the eyes?
Yeah, we do know it is a less significant means of transmission and getting it through the eyes, but we know that can happen, and that's why in the healthcare setting, it is guidance that our healthcare workers do wear eye protection because we know it can be spread. So that is definitely one way that it can spread, and I don't know how significant it was in this case. There were probably other factors related to that, but absolutely.
Okay.
Okay, next question is, do you think it's time that we need to start requiring N95 masks?
Ooh, you mean in the hospitals or in public settings?
Just
I don't think
anywhere.
We need it. Yeah. Let me ask our team. What do you think? N95s on kids?
Probably not an easy or good thing to do.
I wonder if
probably not particularly helpful.
I'm gonna that idea. I'm not trying to make fun of anybody. I just think N95 masks are A, very difficult to wear. B, they have to be fit tested to be effective, which means you have to make sure you've got the right size mask and how to fit it and how to position it. You can't just give somebody an N95 mask and expect it to work. And C, regular masks work. And you could say, well, what about the kids that got infected in this example in California? Good thought, could have been through the eyes. But secondly, the teacher took her mask off. And then it's not like she took her mask off, got a sip of water, and put it back on. She read a story to the kids. And what we know is the Delta variant can spread in 2 to 4 minutes. I think the story was probably longer than 2 to 4 minutes. So, the dynamic of that situation acted exactly as we would predict it would. And I think it's by no mistake that it only happened in the front 2 rows because, again, that's going to be the higher concentration of that teacher's breath cloud getting out to those kids. So I don't think we need to do N95 masks to the general public, Hawk.
Yeah, I certainly would agree with the general public statement. I believe OSHA's new guidance for healthcare
workers
is N95s. But even then, we have seen what has happened throughout this whole pandemic, and we know that the surgical masks, when done properly, and in those situations where you do need N95s, those are worn, but otherwise surgical masks we know have shown protection along with wearing eye goggles, eye protection, or a face mask as well. But for the general public, I don't believe the N95s are needed. It would be good if just the general public embraced just mask wearing in those high-risk situations, not those situations that we were talked about earlier on the show with those outside areas where we know is much less risk, but more in those high-risk situations.
Yeah, I think the OSHA guidelines are important. So, the OSHA guidelines have changed because they didn't recommend N95 with the original strain nor the Alpha variant, but they are recommending it on the Delta variant. And part of that is just the risk of the unknown. We know that the Delta variant is more transmissible. It can happen in a shorter period of time. You have a higher viral load in your nose and in your upper airway that you can spread with. And so as a result, they're saying, gosh, we should do N95s in healthcare situations where we are taking care of a known COVID patient. And I think the challenge for us is that in that environment, sometimes we don't know, right? And so we make sure that everybody is masked. What we also know is that we've not seen spread inside our healthcare system, and we follow this really closely. We have not seen spread from patients to our staff. And that's just with masking. Now, we have a highly vaccinated staff, but it's not 100%. And even before we had that many people vaccinated, we still weren't seeing spread when we were masked. And so I think masking works. I think what OSHA has said is we have a concern about this, and therefore we have a concern about the number of healthcare workers available in the United States. We know there's a shortage. We want to make sure they're going to be protected, and there are healthcare workers to protect people, to take care of folks. So therefore, we're going to step up the requirements on especially really this is more inpatient and outpatient, but really inpatient. We're going to step up those requirements and make certain that people have N95 masks, which is the maximum form of protection, unless you're going to go to spacesuits and things like that. But I think that really what they're doing is taking a cautionary step, and it's a little bit more about the unknown. I was reading one review today, gosh, I can't remember if it was from the FDA or CDC, talking about how in some regards we are still in the caveman world of viral knowledge as far as the coronavirus. We just don't know enough about it yet, and so we're taking all the steps we know we can to keep ourselves safe.
Yeah, 2 points I'd definitely like to hit on, which I agree with you. So we are now in the process of, again, ramping up our fit testing for the N95s because just as you mentioned, Steve, for truly effective N95, you need that yearly fit testing. So we are working and ramping that back up. Although a lot of our providers got fit tested last year when the pandemic started anyways. So I think that's very important to note as well.
All right, you got some numbers for us, Hawk.
Yeah, so here in the hospital, I was hoping that our cases, again, were going down. I was being optimistic, but, for the last 2 days now, we have been in those low 60s again. So right now we have 62 active patients with 19 in the ICU, 14 on the ventilator, and 35 in that recovery period, so a total of 97. And Hays has 13 active patients as well. So we do have some more numbers on our vaccinated, and I think we gave those either yesterday or Monday as well. But right now, again, 62 active patients. Of those, 52 are not vaccinated. So our total population of vaccinated patients is 16%. Again, I think our numbers here at the hospital run a little bit higher for fully vaccinated. But again, I think that's more selection bias. Those are not the numbers that we have heard when we've been on the CMO conference.
It's exactly right. And it's not the numbers that we're seeing nationally. And the reason is that we have a very large transplant population.
Correct.
We have a very large heart failure population, a very large end-stage diabetes population, renal failure population. And what we know happens is those are the patients who are vaccinated and coming in with COVID-19. Yep. It's not hopefully it's nobody, I'm going to even say we're all pretty healthy in this room, although I'm the old guy here, so maybe that's not applicable. But they are still thinking that, gosh, those are the type of people who are not, or who are, quote, the breakthrough infections having to become hospitalized, who were vaccinated. It's really those with a lot of severe chronic illness.
And I think to that point, we have, again, very good peer-reviewed data. There was the large Lancet infectious disease paper that looked at alpha and delta infections in the UK, looking at, I believe, more than 40,000 patients of alpha and delta infections. And even in that caseload, when they broke it down, only 4% of those who were hospitalized were fully vaccinated against Delta. So 96% of their Delta people who went to either the emergency department or got hospitalized, 96% of those people with Delta were unvaccinated. So that is a much larger population, a much larger picture than we are seeing at our hospital. But again, we gave those reasons why we believe that our fully vaccinated population is a little bit higher.
Yeah. So you saw the resignation, I suspect, of the two people from the FDA
Yeah.
and two more senior leaders from the FDA. And part of the reason they resigned, one was retire early, but I think also they were saying, gosh, we're not sure about the booster shot. Mm-hmm. So I got to say I'm a little surprised because I'm not sure, I don't know, I'm not feeling that bad about booster shots. What do you think, Hawk?
Yeah, I think the thing to remember now for the general public is that the current vaccinations and the current dosing, if you are not immunosuppressed, I think we have good data on the immunosuppressed. If you are not immunosuppressed, you still have excellent protection from the current vaccines against all the variants in preventing hospitalization, severe disease, and death. And we have seen that now for many months. I believe we'll have good data at least for a year that you provide protection. Now, some of the booster talk or the additional dosing is directed more towards, again, helping reduce those transmission areas, because we know that even vaccinated people can still have high viral loads, can still have that ability to transmit, although it is less than the unvaccinated population. But after those 6 or 7 days or so, 5, 6, 7 days, those curves do start to switch. And what I mean by that is the people who are vaccinated, their viral loads go down much more quickly than the unvaccinated. So I think if you are turning that point and pivoting to saying, if you have this additional dosing, you may be able to spread the disease less. But again, as far as full protection from preventing hospitalizations, we have 3 or 4 good studies now, large studies, showing that even 6 to 8 months after vaccination, you are still protected from going to the hospital.
As you look, as a rheumatologist, as you look at some of the diseases that kids have with rheumatology, are you nervous about only 2 vaccine doses from Pfizer and Moderna? What do you think about that third dose?
I think so the recommendation coming out of the American College of Rheumatology is that patients with immunosuppressive medications get that booster shot, and I think that is definitely probably a good choice. But in general, I'm not particularly worried about the otherwise healthy individuals who've gotten their first round in terms of. But although most of them have not gotten it until recently, anyways, because it wasn't approved until for our 12 to 17-year-olds until more recently. So.
Okay. All right, Jess. Let's go back to questions.
Okay, Gina wants to know. She says, my 11-year-old daughter had a mild case of COVID 3 weeks ago. What do we need to look for? Also, she seems to have altered taste. So what does she need to look for as far as if there's any future long haul, and wants to know when the taste might return to normal?
What do you think, Dr. Nelson?
Yeah, so I think in terms of the sort of looking out for long haul, it's just kind of it's a general keeping an eye on how she's doing. If you're noticing other things that you wouldn't have noticed otherwise, that seem like new symptoms or new mood changes for her, then having her seen by her pediatrician is a good idea. And in terms of the loss of taste, that's something that we're seeing. For many people, it's a more short-term issue, and it tends to return to somewhat normal relatively quickly in a few weeks when people are noticing that symptom. However, I have seen a patient or two that have had ongoing loss of taste and smell for over 6 months. However, the last one I saw was actually his taste was starting to return, his smell was starting to return when I actually saw him, and he's about 7 months out. And there are things we can do to help kind of move that process along.
All right,
Kelly wants to know, are we seeing breakthrough cases in teens the way that we're seeing in adults?
I don't have great data on that in terms of, I am not aware of really great data on that at this point. So I would defer that question to somebody if any of you guys have any general idea on that. But
I've not seen that about kids because first of all, we've only been vaccinating kids from 12 to 18 for a while, or 12 to 16 for a while. So it's a little bit early, I think, to know the answer to that question. So I don't know the data. I was just looking at CDC stuff last night and this morning. I didn't see anything about it.
Yeah, I would agree with you, Steve. I think it has been such a short period of time. So I think that we do need that time factor in to really do that. But I haven't seen any large publications in those major journals such as New England Journal of Medicine. Obviously, I'm not going through a lot of the pediatric data, but either the CDC publications, New England Journal of Medicine, Lancet, or anything like that, I'm sure those studies are being done. It's just that we do know overall hospitalizations in pediatrics are much lower, so I think it would take time to collect all that data. I think you'd probably need to do a multi-center trial or a study for that.
All right, Holly's looking for some advice. She says our school recently moved to masks being strongly recommended. She says that her kids are vaccinated, but they're not wanting to wear their masks because they're vaccinated. What are your thoughts on that? She says she's torn as a parent, and she is pro-mask. What would you think about
that's a
that?
Great question. So let's take that on.
Yeah.
I'm still wearing your mask because you can still spread the disease even as a child.
you can spread it, and we've discussed it, and it may offer you some protection as well. And I mean, I know I'll be the first one to say I hate wearing my mask. I've gotten used to it at this point, but I'd love to not be wearing a mask. But I'll do it as long as the science says that it's still a good idea, and it does. So I think I would still recommend they wear it.
Yeah, I think that's good. I think that's an insightful comment by the children, an insightful question for sure. I think we all hate wearing masks, but we know we have to do that at this point in time. We know it'll keep us safe. Being fully vaccinated as a child is good. We want to encourage everybody and parents of children 12 and up to get their children vaccinated. But I think it's also important to understand that if we can have everybody in that population, whether that's a classroom or whatever that might be, a sports team or some extracurricular group, wearing their masks, that will definitely reduce the chance that any one or a few people in contact tracing may have to sit out and miss participation days or miss school days as well. So I think it is important, not really for the individual illness aspect, but just as we heard our guest talk about, for other issues, either bringing it home to people or spreading it to their colleagues or classmates, whoever they may be around as well.
Yeah, I think that's really important because remember, if you if you don't have your mask on, even vaccinated, you can still spread it. Much less likely, still can do it. And what you don't want to have happen is if the other kids aren't wearing their masks, then they're more likely to get it, and then you're more likely to close school down. Yeah. Because not everybody in the school is going to be vaccinated. Because we know kids don't have as high a vaccination rate as adults yet, although creeping up. So, if the objective is to stay in school, the best way you can do that is to keep masks on. And you don't want people taking it back home to their folks. So, again, it's the same thing we said last fall, or wait a minute, maybe the same thing we said back in March of 2020, a year and a half ago. Oh, wait, it's the same thing we would always say about infection prevention and control. The rules of infection prevention and control travel with you, and they keep you safe wherever you go. Including school.
And I hope and suspect we'll get back to that point where we were in the spring of not masking.
Oh, I think we are too.
It's just going to take a little bit of time now, and we'll kind of try to get this full vaccination issues and guidance under wraps and take it from there. But.
Very interesting information coming out about the waves of coronavirus and SARS-CoV-2, whether it was the Alpha variant, the original strain, or now the Delta variant. And each one of these, in any given area, the wave can last about 2 months. And people don't really understand why it only lasts two months or so. And so we're going to show some data about that tomorrow. There's a nice article published, I think, in the New York Times, and reference some stuff coming out of the CDC and some other places about it. Pretty fascinating. And we'll show some of those curves tomorrow and talk a little bit more about that. But I think the key is that when you have those waves and you have vulnerable populations, you're trying to protect each other so that you can help stop the spread of the virus. And then, like you said, last March, with a small number of people vaccinated, we were back to kind of normal life, and we had 2 COVID positive patients. What changed here was the Delta variant, which is so much more transmissible. What we have to believe in is that masking will help us contain the damage on the temporary basis, while vaccination helps us contain it on a long-term basis, and that's how we get back to normal.
And I think right now we're going to be seeing, because of this wave right now, plus the full number of vaccinated people, just as you have said before, Steve, I think we're looking towards more of that population immunity, either hopefully mostly by vaccination, but I think a large amount through some natural immunity. Now again, the question still remains, if I've had COVID-19, do I need a vaccination? Absolutely, the guidance is yes. The best information says that even people who have had mild COVID-19 disease, when they get at least one dose of mRNA vaccine, their antibody levels boost. Their ability to generate that specific immune response even quicker is boosted as well. So further questions, do you need the full dosing? Those questions are being investigated right now. And unfortunately, through natural infection, we are seeing what we're seeing now. So we're seeing a lot of tragedy, a lot of suffering because people are ill, people are missing work days, but more importantly, people are getting ill enough to go to the hospital, and we're seeing the hospital capacity issues and a lot of death right now through this natural infection process. So much better to get vaccinated and save that.
So you know what? I think you and I have found more ways than you could shake a stick at. There's a good Midwestern term that's very medical. That to try and say the same thing every day about, gosh, get vaccinated,
Yeah.
gosh, wear your mask. And hopefully people somehow are getting that message.
Yeah.
Jess?
Sarah says, I'm vaccinated. I'm less worried about dying now than I was this time last year. But what about long haul COVID in vaccinated people? And also, is there a different risk of long hauler COVID with Delta?
Yeah, let's speculate a little bit, because I don't think we really know that for sure yet.
Yep.
When our long haul adult specialist was here from internal medicine last week, not seeing a lot of vaccinated patients yet, and the ones that come in that I understand that when I read about tend to be less severe. Dr. Nelson, what are you hearing about that?
That again, the kids are, everything with the kids lags a little bit behind. So I'm following some of the adult stuff, and that's what I've heard as well. What I will say is that we know that one of the things that can help our long haulers, and that seems to be true in pediatrics as well, is actually getting the vaccine. If you're able to get it and you've got long haul symptoms, then the recommendation is to get the vaccine, and that seems to help people.
Yeah, and I'm gonna speculate that if you've been vaccinated, Hawk, you're gonna have less long haul syndrome. If you do get it, and your chance of getting it is less likely, because we know that well, it seems to be true that vaccination helps long haul syndrome.
Yeah, I agree with you. Total speculation. We do believe that your risk of getting long haul is decreased if you're vaccinated. We also believe that if you do get it, overall the symptoms are going to be less. The quality of life will be better than if you were unvaccinated getting long haul symptom. But that question needs to be addressed specifically. But I think we're all believing that it will be less overall.
So Sherry wants to know, since the FDA approval, are we seeing an uptick in vaccination?
I don't know that we're necessarily seeing an uptick. There's an uptick in vaccination in the United States. I'm not sure if I'm going to say that's because of the Delta variant and people being a little more fearful, or it's because it's been an FDA-approved drug. What we are seeing is that more organizations are requiring vaccination to be employed there since the FDA has approved that through Pfizer. Thoughts, guys?
I don't know that we have because of the approval. I think we certainly know that with the approval or guidance of the third dose for immunosuppressed, we know those patients are really more in tune with their health and wanting to do the right thing in their medical care. There was certainly an uptick there, but I don't know about in the general public.
Yeah, and what I would just say, too, is we know when we look at the heat maps, there's still a lot of COVID-19 out there, and it's continuing to spread from the central into the southeastern United States, and now spreading up through the Midwest and into both coasts. And so I think there's a lot of people at risk, and they're feeling the risk. I think that may be driving some of the uptick in vaccine. Vaccination in the United States had fallen down to about 500,000 to 600,000 a day. It was getting close to back to 1 million, which is where it was when the vaccine came out. So I think there's been an increase. I know there's been an increase, significant increase in vaccination rates in the United States, and hopefully that'll sustain us and get our population more and more vaccinated. We'll try and show some of that data. We have that data from the New York Times tomorrow. We can bring it up.
Dr. Stites, okay, so can you do some clarification? There's a few people on here asking questions about this, but I'm going to ask Susan's question. She asked if you could please revisit the California class teacher reading the story incident in California, because there's confusion about the effectiveness of mask wearing because so many kids got it. Can you just help us understand the mask situation?
Well, first, let's remember what masks are designed to do. Masks are designed to prevent you from giving disease to someone else. That's really the number one effective masking for surgical masks. And 95 are different, but surgical masks. Surgical masks were also demonstrated to reduce by about 70 to 80% the likelihood that you were going to get coronavirus with the original strain. The Delta variant is much more transmissible than the original strain, right? The original strain, one person was going to infect, between 2 to 3 people. The Delta strain is more like 6 to 10 people. The original variant took 10 to 12 minutes of being in somebody else's breath cloud to communicate the disease, transmit the disease. The Delta variant's more like 2 to 6 minutes. So it doesn't take as much time. You have a higher degree of viral particles in your airway from the person who's transmitting it. And masks were known to be 80% effective against the original variant. They're less effective against the Delta variant for you getting the disease. Masks are incredibly good at preventing you from pushing your breath cloud out there. Remember our times in the freezer. But I think the key to this is that in the situation with the teacher, the students who are in the first 2 rows are the ones who were much more likely to get COVID. The ones in the back part of the classroom were much less likely, which is true, what you would think would have with infection. What we don't know about the kids in the first 2 rows, did they have their masks all the way on? Were their noses exposed? Did they take their mask off a little bit? What was the quality of the mask? We don't know. I don't know the answers to those questions. And so I think we have to be careful about making a broad generalization based on that specific situation about masking. I turn to many other stories that have been shown that masking does prevent transmission indoors, even to those other folks. So there's just a lot of variables you have to think about. What kind of quality of the mask? What was the material of the mask made of? It's clear that some of the old single layer material masks, the cloth masks, don't work very well against the Delta variant. We know that. So I just don't know what the quality of the masking was. And as we talked about earlier, we don't know what happened with their, because they've gotten it through their eyes. So lots of questions remain to be answered. The key to this story is that first, the teacher was unvaccinated, so she would be shedding the virus for a longer period of time. And 2, she took her mask off and read a story. And that's really the key. That's really the answer to this question, Hawk.
Yeah, I think it goes back to early on in the pandemic when we were talking about the hairdressers, 2 of them that had the infection. Now, again, it wasn't Delta variant, but they were very close with their clients. Both the client and the hairdressers who were infected at the time wore the mask, and there were, from the people that they could interview, there were no cases traced back to that because of that barrier protection. So I think the important thing here is that barrier protection. Unfortunately, we don't know the best or the practices of those children. Usually children are pretty good and are able to keep it on during those situations, but we don't know all of that information in detail. So, and I think that, as Dr. Stites mentioned, the surgical mask, but also the cloth masks have been shown, depending on what cloth mask it is, to reduce your ability to inhale some of those droplets anywhere from 20 to 50%, depending on the cloth mask, but also depending on the fit. And we talked about this yesterday, how important the fit is, whether you're wearing a surgical mask or a cloth mask as well. But just in the same publication, MMWR, a few weeks earlier, we did see a good contact tracing and a good information about a school district in Georgia that had 30% less infections and less incidence rate of COVID because of masking and good ventilation. So there is plenty of that information out there. This was one particular contact tracing episode that they saw this happen.
Julie wants to know, are they still doing the studies on the MMR shot and Tdap helping with mild and moderate cases in COVID?
I don't know the answer to that, guys. Dr. Nelson?
I don't know the answer to that.
That was big early on, thinking that you are priming your immune system. I haven't seen anything since that time, so I really believe that it has kind of just fallen by the wayside. Certainly haven't seen any news about that particular vaccination or any other vaccination contributing to further immunity in prevention of infection or prevention of significant COVID-19 disease. I think they were looking at the polio or BCG vaccine as well, but I haven't seen any more information about those.
And to just come back to that question about vaccination and rates, I was sitting here and looked that up. We fell down to about 500,000 to 600,000. We're up to 899,000 on average day, so about 900,000. At our peak, we were at 3.38 million doses per day. So far below the peak, slowly crawling up. About 62% of all Americans, including children, are now at least have had one shot, and 52% have had two shots. If you jump and say, what about those 18 and over, where 74% have had one shot and 64% have had two? Had 2%, yeah. So it shows we are increasing. Gosh, if we could get up to 3 million a day, in a month, we could come really close to ending this.
Yeah.
And so I think, man, if we could just get people to be vaccinated, I think that's how the worm turns here. That's how we really get ourselves back to normal.
And I think that's important as we're moving into colder weather now, and people are going to be doing more things inside as compared to outdoors.
And pretty soon, the flu shot's going to be out because, right, that'll be, we're in the early part of September. Sometime in the next couple of weeks, we expect to start getting our first vaccinations. I've been looking at the MMWR or the CDC websites to look and see what's the flu report, and it's still pretty low so far.
Yeah, absolutely. And I looked at the Australia data a couple weeks ago. Now their data is just a little bit behind in their collection and analysis, but as of that time, they had still really only had less than 500 laboratory confirmed cases of influenza in Australia. So still very low activity there. However, again, we would say all the countries are different, and we know our practices here in this country for the majority of areas and communities, which is still gathering, not wearing masks and things of that nature. So we certainly could have much more activity than we did last year.
Couple more questions, Dr. Stites.
Yes, ma'am. Let's do it.
Okay, Marty said.
We'll go quick.
Okay, yeah. So I think this is a quick one, but I'm not sure. Okay, I'm here. Marnie says, I'm hearing people say that you can have a stroke after getting the COVID vaccine. True or not true?
Yeah. Okay. So that's a hard one. Let's be honest about it. There's a very low risk of getting a stroke, especially after the Johnson & Johnson vaccine from vaccine-induced thrombotic thrombocytopenia, which means that your platelet counts your platelets do funny things. What we know is there is a risk of stroke in the population. Does vaccination increase that risk? And the answer to the question is, be very careful what you wish for here, because you could say it's a little bit increased with J&J, not so much with Pfizer and Moderna. The problem is if you get COVID-19, the risk of stroke is much higher. And so just be thoughtful about it. Yeah. So is there a risk? Yeah, very small, very, very small. But man, the risks are so much greater if you get COVID-19 hot.
Yeah, I think that's exactly the bottom line. There was a good MMR about it a few weeks ago looking at myocarditis, the vaccine-induced thrombocytopenic thrombosis, again, which is more in the sinus area. And then
the brain, the sinuses in your brain, by the way. Yep.
And then the Guillain-Barré syndrome. And what they found from that was, first of all of those cases were extremely rare. And your risk of getting any one of those problems or complications, or even worse complications, from the disease itself, much, much outweighed any of that risk of the adverse reaction from the vaccine itself.
What do you think, Brad?
I'd go back to a lot of the other vaccines that we've had these questions on before, and the question's always the correlation versus causation. And these things have been looked at. Vaccines have been studied for many years. We've had them around for a very long time, and I think that I would go with the science when it's telling us that your risks of not being vaccinated are so much higher than when you get the vaccine. That I would stick with that. Stick with getting vaccinated.
And come back to this point too, guys. Long haul syndrome is terrible, and between a quarter and a half of all patients with COVID-19 end up with long haul syndrome. You'll have some symptoms for up to a year, and you may have it for the rest of your life, especially if you have lung scarring. Geez, compare that against the risk of the vaccine. It's just, there's really no choice, right?
No.
There really is no choice here. Not really. And you can say, well, the risk of death isn't very high. Okay, risk of death may not be very high with COVID-19. It's still very real. 1%, 0.5%, that's still very real. But your risk of long haul syndrome, that's bad. Don't do that. And vaccines look like they reduce that. Jill
wants to know, are they studying the blood work of children under 12 to see if they're getting antibodies from being exposed to low viral loads from being at school, even masked or around family members?
What do you think, Brad Nelson?
I don't know. I don't know the answer to that question. I don't know if they're looking at specifically unvaccinated children under 12 and viral loads.
Yeah, I don't know either.
Yeah, I'm sure I don't fully understand that question. I understand kind of the spirit of it, but I think we have to understand, number one, currently, and what has been going on for the past few weeks, Delta variant is the predominant variant around our community, around most of the nation. What do we know about Delta variant? You have extremely high viral loads that you replicate in that upper respiratory tract. So you express that into the environment. If children are coming into contact with those droplets or those microaerosols, it will be getting into their upper respiratory tract, and what we do believe is that it takes a very small amount of viral particles to cause infection. So you aren't just going to be walking through and getting exposed without getting disease. Now again, we know that a lot of children are probably not getting any symptoms at all, but we have seen that currently with Delta variant, a lot of children are getting ill. So in order to be doing that, you would have to find children that have never had symptoms of infection and then look at their antibodies. The bottom line is you probably aren't just being exposed and not having any illness at all right now currently with Delta variant. So any studies like that you'd probably be doing on children that have been ill and have had some symptoms.
Final thoughts, guys. Dr. Nelson.
I think, I know we've harped on it, but getting vaccinated.
Getting vaccinated and and you don't want to see a lot more long haul kids.
And I don't want to see more. I love seeing patients, but I don't like seeing long haul patients because it's rough to go through.
All right. You do your mom and dad proud, Dr. Nelson. Thank you for being on the program
Thank
today, even though your dad is kind of dorky guy. Hawk?
I think these were great, insightful questions today. Hopefully we gave you the answers that you were looking for. We will continue to encourage vaccination, encourage doing the right thing. We do believe we will get through this current surge, hopefully sooner rather than later, and continue to build population immunity, especially by vaccination, as this contributes to much less reduced hospitalizations, severe disease, and death, much less long-haul syndrome as well. But overall, we're making it through one day at a time, and I think right now the caseloads from what we are seeing, although not the best measure probably, the caseloads do look like they're coming down.
Yeah, we want them to come down, and the Kansas City area is clearly flattened, maybe dropping just a little bit. Hey, one thing that isn't going high like we needed to is our blood supply. It is way down. Blood donations are way down. Our local blood shortage is at an emergent level. This is an incredibly concerning time for our emergency rooms. Not only are they overwhelmed by COVID, but now there's not enough blood to help patients who need that. This is where we need you to step in. Donating blood is safe. It takes 1 hour. The Community Blood Center is taking extra precautions to prevent the spread of COVID. We know they don't have spread inside the Community Blood Center because they do a great job. It's all about masking, just like it is in the hospital. To schedule an appointment or learn about hosting a blood drive, call a number or visit the website on your screen. There is an emergency, savealifenow.org. Please, please help us. You can really make a difference like that. COVID's hard, and I'm exhausted. Are you guys tired? I'm exhausted of COVID. I want it to be done. In order for it to be done, we need you to help us. And the way you can help us is what we say all the time. Follow the rules of infection prevention and control. Get yourself vaccinated, and wear that mask, which is a way of saying, I love you, and I want you to stay healthy, too. Thanks for being with us today. We're back tomorrow with another morning medical update. Jess and I are joined by Amanda Cackler, the Director of Infection Prevention Control, on what you need to do to stay safe as we head into the Labor Day weekend. But we leave you with this message from a mother whose 4-year-old daughter was recently diagnosed with COVID. Her advice for other parents now that their kids are back in school.
She went to bed and had kind of sudden onset congestion, which for her allergies are normal. But then she woke up about an hour and a half after falling asleep, and I could just tell she had a fever. And so we moved her into our room, and she just seemed kind of miserable. They ran a strep test first to eliminate that before we did a COVID test. But really left it up to me whether we were going to test for COVID or not. The nurse practitioner was convinced it wasn't going to be COVID, and so was I. Her fever only lasted, it spiked a little bit Monday evening, so we hit her with some Motrin, put her to bed. I was at work for maybe an hour and a half, and they called and left a voicemail, and I knew then that they were going to tell me it was positive, and it was a gut punch. I was composed for a while, and then I did cry, because I feel like 18 months of holding our breath and 8 days into school, poof, it was gone, and my child now had COVID, and it was really surreal. You know, I'm a teacher. I teach kids with special ed, and they don't wear their masks as well as some students do, and so, you know, I really knew it was my responsibility to get a test that day to know, you know, if we had been exposed. You know, I feel, again, it is my duty before I go back out into the community to make sure that I don't have, you know, even as a vaccinated adult, that I don't have it and I'm carrying it. It's just be ready. Be ready to test, be ready to ask for the test. If you want to know, I think you're going to have to ask for it, because again, that was the biggest surprise to me, was that wasn't the first thing offered to us when we walked into the doctor.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.